Hello, welcome to the Division of Fee-for-Service Management Provider Training. Our presentation today is titled Behavioral Health Residential Facility Claim Submission Training. Please note that these materials are designed for fee-for-service programs, including American Indian Health Program, Tribal Regional Behavioral Health Authority, and Tribal Arizona Long-Term Care Services. So let's get started. Providers can log on to the AHCCCS Online webpage by entering the URL below. You will require a username and password, and once you enter that information, just click the Sign In button. On the left-hand side under Menu option, select Claim Submission, and BHRF services are submitted using the Professional Claim form. Next to Type of Claim, select Professional from the drop-down box, and then click the Go button. On the Professional Claim Submission page, there are 8 options or tabs to choose from based on your provider type and the service to be billed. The Submitter tab will show your organization's information. If this is correct, move on to the next tab, which is Providers. On the Billing Provider tab, enter your tax ID number and check the EIN bullet. Next, enter the facility's NPI number and click the Find button and select the correct NPI from the drop-down box. In the Entity Type field, select the option Non-Person Entity. The Service Locator and Pay to Locator fields, click the drop-down arrow and select the location that is a match for your facility. After completing these fields, go back to the toolbar and select the next tab, which is Rendering Provider. On the Rendering Provider tab, enter the facility's NPI number again and click the Find button. Select the correct NPI from the drop-down box. In the Entity Type field, select Non-Person Entity. After completing these fields, go back to the top of the toolbar and select the next tab, which will be Patient Subscriber. On the Patient Subscriber tab, enter the member's Access ID number, always beginning with the letter A, followed by the 8 numeric characters. Next, enter the date of birth for the member in this format: 2-digit month, 2-digit day, and 4-digit year, and then click the Find button. If the member's information is a match, go to the next field, which is the Payer Responsibility field. If Access is the only insurance payer the member has, click the drop-down arrow to select the Payer Responsibility option, P for Primary. After completing these fields, go back to the top of the toolbar and select the next tab, which will be Claim Information. On the Claim Information tab, enter the patient control number. It is a common practice for providers to use the Access ID number as your patient control number, and you can enter that information here. Next, complete the provider signature on file, provider accepts assignment, benefit assignment, and release of information consent as shown below. After completing these fields, go back to the toolbar and select the next tab, Service Lines. Complete the fields as identified below. 1, select the ICD-10 bullet. 2, enter the diagnosis codes without the decimal point. 3, diagnosis code pointer fields. Check the diagnosis code pointer box for each diagnosis code that you entered in the diagnosis code field. In this example, we have box 1 and 2. The service dates field should be entered with the begin and end dates of services for your claim submission. Line 5 is your line charges. Multiply the total number of days billed by the per diem rate and enter that amount in the line charge field and include the decimal point in your dollar amount. Quantity field, enter the total number of days billed and select the unit's bullet. In the HCCCS code field, enter the code for billing for the behavioral health residential facilities, and that code is H0018. Almost done. Let's move over to the right-hand side of the page, next to the heading, Place of Service Code. Click on the drop-down box and select Place of Service 99, which identifies Other Unlisted Facility. After completing these fields, click the Add button to accept the claim information. As a note, all fields with a red asterisk must be completed. After selecting the Add button, the system will bring back the information that you've entered to give you an opportunity to verify the data. We have line number 1. You will see the dates of services that you entered. POS, place of service, we see 99. HCCCS code H0018. Diagnosis code fields 1 and 2. Those boxes are checked as well. Total units, which represents the total number of days that you're billing. And last, your total line charges. If everything looks okay, then you can hit the Submit button. If you need to make a correction, you can simply click on the pencil icon, which is our edit tool, make the correction, and then hit the Submit button again. If there are no errors identified, you will receive a confirmation that the transmission was successful. If the system identifies an error, for example, a field is missing information, the system will show you the error message. Simply make the correction by selecting the appropriate tab, correct the fields, and then select the Add or Submit button again to accept your correction. From this page, you're able to view your claim again, or simply go forward with entering additional claims. That will conclude our training today on how to submit a claim for behavioral health residential facilities. Thank you so much for your participation.